As the Arkansas legislative session draws closer, one organization has its list ready of legislation it hopes to get passed. 5 News anchor Darren Bobb tells us the Arkansas Alzheimer Association has several major requests.
At the top of the list is more funding for the Respite grant program. It allows caregivers of dementia patients to apply for a grant to hire someone so they can take a short respite from caring for their loved ones.
If we invest in caregiver support, we can allow people to age in place longer and delay placement in more costly care settings. Many of our caregivers also have children at the homes, and so they're caring for an aging parent, but also caring for a child in the house. So this gives them a time to take that respite to attend to other household duties.
Right now, that program gets $200,000 from the state. David Cook with the Arkansas Alzheimer's Association says it needs to be more.
Kansas has a program similar to this that's funded at 650,000. So you can kind of see the gap. We only have 200,000 annually; they get 650. So we need more money to ensure that there's greater access to this grant program.
Cook says another big ask is funding for public awareness and research.
The FDA has approved 2 treatments for Alzheimer's patients, but these treatments are only effective for people in the very early stages. So it's essential that public health establish a campaign and get more aggressive in spreading the word across the state about the importance of early detection and diagnosis of dementia.
He says state lawmakers are finally starting to pay attention.
And what we are learning as we have conversations with lawmakers is that many of them feel it personally. They've either lost a family member or they are caring for someone who has a diagnosis. And so it's not a red or blue issue. It is certainly bipartisan. It touches everybody. And it's one thing that we often say that brings lawmakers together.
Covering news where you live, I'm Darren Bobb, 5 News.
Cook says the list of recommendations has been sent to the governor's office and leadership in both the State House and Senate for review.